Hi, everybody. Nancy A. here from Professional Movement Solutions. Welcome to members of the Living Well Academy. I want to show you today an exercise, which is a great core strengthening exercise, but also something you can do to improve spinal mobility as well. It's one of the more basic fundamental exercises, whether you're talking Pilates or any other core training, and it's a pelvic tilt. In particular, a posterior pelvic tilt in one direction, and I'm going to demonstrate that for you today. But, it's simple, but don't negate, don't discount it as not important. It is seriously one of the best initial core strengthening exercises you can do. And what I want to do today is show it to you in 3 different positions, because there's a lot of flexibility in this exercise depending on your health status. So I want to share those 3 with you today. So again, a pelvic tilt. We're gonna start with the easiest one and then go to a little bit more difficult versus a little bit more difficult. And difficult is subject to interpretation. There's just some things to watch out for, and I'll explain that as we go. Okay. So pelvic tilt. What I want to do is start by laying on the mat here. So what I'm going to do is get on the mat on my back, and with this, okay, so with this with my body supported on the mat like this makes it a little bit easier to handle, to negotiate, right? So here what you're going to do is you're going to tuck your belly. Posterior means that your low back, that arch in your low back, is going to flatten against the mat, and it's going to go towards the back of you, okay? Posterior pelvic tilt is really all that means. And then we're just going to relax out of it, right? If we were to do an anterior pelvic tilt, we would go up away from the mat, but that's not what this is about. This is just a matter of strengthening, again, deep abdominal muscle called transverse abdominis, okay? And then relaxing it. You do work, like I say, a little bit of that spinal mobility at your low back as well. Okay, so I'll move. You can have your arms at your side as you do it. I'll just move my arm out so you can see it on the camera a little bit better. But again, what I'm doing is tucking my belly button down, flattening my back against the mat. You can hold a 3 count, a 5 count to start, and then just release it. Just return to that starting position, right? And again, pull in that belly, 2, 3, and release, right? You don't want to hold your breath, so think about exhaling as you do it. It's a great strategy too. And there's a tuck, 2, 3, and release. So you're letting your abdominals do all the work here, okay? So that's a pelvic tilt laying down on the mat. The second one I'm going to show you is seated, okay? So I have a chair here. I'm just going to pull it up a little bit, angle it a little bit better. Okay, here we can do the same maneuver in this chair. You're seated at the edge of the chair, feet are well supported on the floor or other device, right? And just to kind of bunch up my shirt here, right? There's a natural curve here in my back. But when I tuck my belly, you see it flatten a little bit, right? And then you release it. So again, you're working this deep abdominal muscle, transverse abdominis, a little bit of mobility going on here at the low back, lumbar spine, right? And one more, it's just a press. It's very subtle. It's very subtle, okay, but very effective, very effective. So on the mat is easiest, and you have a lot of feedback because your back is touching the mat. Here, I don't have a lot of feedback. I'm not touching against anything, right? But I can feel it. I can feel it happen, okay? It's kind of like you're on these sit bones and then you rock off them a little bit, and then you come back on. Just subtle, okay? The last one is standing. The last one you can do in standing. So I'm going to use my door, making sure it's closed, of course. I've got a semi-gloss finish here, and that's easier to slide. You could certainly use a wall, a bare wall, to do this with. It works just fine, okay? I've got my feet away from the wall here. Again, we use what we have, right? We use what we have. My feet are a little bit away from the wall, and then what I'm going to do is just bend my knees just a little bit. I still want my knees behind my toes. I don't want them past my toes in the forward direction, okay? That being said, watch out for any knee pain, joint pain that may happen as a result of doing this exercise. If that is the case, please choose seated or lying down, okay? Joint pain is something we want to listen to. It's what we want to listen to. The benefit you do get, a pro of doing this, is that you get a lot of good big muscle group leg strengthening benefits here as well in this position. But again, here, right, what we can do might be a little bit harder to see, but it's the same thing that we did seated and laying down. I'm going to tuck the belly, flatten my low back against the wall or door, and I've got that feedback now, that tactile feedback to help me. And then I just relax it. Just return to that starting position and then tuck again, 2, 3, and relax. And I'll just show you with arms at your side, 3, 2, 3, and relax, right? Again, exhaling with this is a great strategy, right? So pelvic tilts, great core exercise, core strengthening, spinal mobility benefit as well. And there's a lot of different positions you can choose to make it comfortable for you and successful for you. And that's what matters in the end. So give it a try. Please let me know if you have any questions and keep moving. Thank you.